Good afternoon. Thank you, Mayor. Thanks for this opportunity again. Start off by acknowledging some of the great work that's going on in the organization. The first team I want to recognize is our finance department team. As you all know, many of our workers here in City Hall are able to work from home, but much of the work that the City Finance Department does really require that the staff come into the office here at City Hall every day. So just want to acknowledge the great work in our accounts payable team, which facilitates timely and accurate payment of the city's disbursements. The payroll team, which continue to make sure we all get paid. And the investment team, which manages the city cash flow and invests city funds in accordance with our policy. So really appreciate the work of the finance department and the staff that are coming into City Hall every day to make sure that all this important work gets done. Next, I want to recognize an individual from Public Works. His name is Reggie Roberts. Many of you may know Reggie from being here in City Hall. Reggie's worked for the city since 1999 when he started out in the city's warehouse and then transitioned into the mailroom, the city's mailroom. You know, aside from always having a really good attitude and a great sense of humor, you know, his work in processing and receiving the city's mail has been really essential for us keeping things going here in terms of our city operations. And in addition, Reggie's taken on additional duties that of taking on the bids that come in from vendors so that we can accept those bids formally. Reggie's taken that work on to make sure that especially our public works projects can continue on in the process. So really thank you to Reggie for coming in, doing the work, and then taking on additional responsibilities to make sure things keep happening. Okay, I'm going to get into the update, the COVID update. And so just give a little bit of an outline on what you're going to be hearing from us. First, Kip will give an update and really a report out on kind of where we're at with testing, tracing, and supported isolation. These are issues that we've been talking with and working with the county for some time now. These are also issues that are highlighted in the mayor's back to work memo, and how we focus our efforts in this area will be hugely important, to say the least, in terms of our success in recovery efforts and keeping people safe as we reopen the economy. Second, we'll have an update on the financial recovery from Lee, Luce, and Jim. I just want to stress that next week we will be issuing an MBA that recommends how we fold the recovery funding into our proposed budget. So that will be happening next week, and you'll be hearing more information today as we understand the current lay of the land. And then finally, Kim and Rosalind will be providing an update on development services and our progress with supporting the development community. Okay, so I'm going to pass it off to Kip to kick it off.
Thank you, Dave. Kip Harkness, Deputy City Manager, and on behalf of Lee Wilcox, my co-Emergency Operations Center Director, and the 631 people currently deployed in the Emergency Operations Center and supporting emergency operations in the field, I want to present this update as the City Manager has described. We do have a lot to get through, so I'll clip through a fair amount of material quite quickly. First thing is some good news about an updated county order, which broadens and allows retail in a limited form, what when I was at PayPal we used to call BOPIS, buy online, pick up in store. So you're now able to do curbside or outside pickup for retail, but customers are not allowed to enter the store as of, this will be effective 12:01 a.m. on Friday. Also, businesses that support retail can resume operations. That's very narrowly tailored to include those that are manufacturing goods directly for those retail stores and businesses that provide warehousing and distribution services. In addition, outdoor museums, historical sites, and publicly accessible gardens can reopen, as well as car parades are now allowed as long as participants ride with the same household and do not stop to gather. Finally, the social distancing protocols have been updated, clarified to include the California requirements and requirements for training of businesses. I think, Mr. Mayor, I think your mic is still on.
Please forgive me. I'm sorry.
No problem. Um, Starting with principles, our recovery principles, as always, are to be compassionate in action, to be open, candid, and direct, and to be one team. And the work that you're going to hear tries to embody each of those. So each of these is an aspirational, not a goal of perfection. As always, we are guided by our roadmap, which focuses us from the myriad of interesting things that we might do to the vital few. And with that focus on the roadmap, in the last week, we have delivered 2.75 million meals with our community partners. We are bringing together and bringing forward an item on the city county food agreement for your approval later in this afternoon. We have activated a number of testing sites, including the PAL testing site, which we'll hear more about. We've launched a virtual community engagement branch to begin to make sure that throughout the recovery, we can engage our community more robustly. And we continue to shelter many of our individuals who need support in hotels and motels, as well as safe sheltering facilities. So as mentioned, I wanted to go a little more deeply into testing, tracing, and supported isolation. These three services are all led by the county. And so what I'm really doing here is describing a county role and that they lead, and our role as a city in supporting them. The reason that these three services are important is they're absolutely critical to us coming out of the shelter in place. So we don't know what's going to happen next. There are three scenarios that I think help us think about that sort of in priority order, if you will. Priority number one, or the first scenario, would be this notion of a slow burn, which is we've brought the cases down and that we continue to keep them down. And in order to do that, we're going to need testing to see where we are, tracing to make sure that it's not getting out of control, and supported isolation to make sure that those people who can isolate can do so safely. If we're not able to do that, we'll start to see an uptick. And we'll start to see scenario two, the sort of peaks and valleys where we see an uptick in the number of cases and the number of deaths, and then we have to maybe take a little more restrictive action to bring them back down. The worst case scenario, and the one that we most want to avoid, is number three, where we lose control and there is the big surge in cases that we have been working so hard to avoid. The danger and the timing of this is uncertain, but the most likely timing is in fall. Coronaviruses, which this is, and influenza typically follow a bit of a cyclical and a seasonal pattern. So if this coronavirus is like others, it might give us a little bit of a break over the summer, but it also might come back strong in the fall and winter. And it would come back at exactly the same time that the normal flu season returns. And to give you a sense of what that means, during a normal flu season, our hospital system is at 90% capacity. So if this were to come back on top of the normal seasonal flu or even a bad year of flu, we would be in a really tough situation. And likely, whatever progress we'd made would have to slip back into full-on sheltering in place. So the idea is that we want something more like scenario one, and that testing, tracing, and supported isolation are required in order for us to stay in that scenario. So let's dive a little bit into those three. What I'd want to do is I want to take each one in turn, describe what it is, what the county's measure of their success is, where they are, and then just talk a little bit about the potential role that the city might play in each one, realizing that that is all to be determined and part of ongoing conversations between us and the county. But we wanted to make sure that council was both informed and had the opportunity to discuss so that that can inform our collaboration with the county. So testing, broadly speaking, there are two types of tests: diagnostic tests and serological or antibody tests. The diagnostic tests are ones that will tell you if you currently have the infection. The main form of this is what's called a PCR test, or a polymerase chain reaction, which amplifies the presence of the RNA, the virus itself, in order to detect the presence of the virus. And you can see a kind of a cool chart off to the side that walks you through the steps. Anybody who's done the old school replication and amplification of DNA or RNA samples knows that this has gotten increasingly sophisticated over the years. But this, you have to actually have the virus in you. You have to be infectious or near infectious for these tests to work. The other one is a serological test, which tells you if you've developed the antibodies in reaction to having had the virus at some point in the past. These are useful to determine people who were previously infected, but no longer infectious or no longer have the virus present. One thing I want to be clear on is that in many diseases, having had the disease conveys immunity. We believe that is the case with COVID, but the amount and the duration and the degree of the immunity is very much unknown at this point. So a serological test does not sort of give you an immunity pass to go out back into the world as it was before. So that's testing. Where we are at as a county is our kind of first hurdle that the county has set for themselves is they want to get to about 200 tests per 1,000 people, per 100,000 people per day. That's not the absolute number. That's sort of the first threshold that they want to get to feel like they have a good ability to survey and understand what's going on. Because we know that the testing that's going on now is not keeping up with the actual virus as it's circulating. So right now we are about at 100 tests per day per 100,000 people. So about halfway to that initial mark that the county has set for themselves. Eventually, people are talking, so that's about 4,000 tests a day is what we're aspirationally getting for the county. Eventually, some people are talking about, like Dr. Sarah Cody and Dr. Marty Finsterscheib, wanting to be able to get up into the 13,000 to 15,000 to 20,000 tests a day to really be able to get a sense of what's going on. But clearly, there's a long way to go before that point. Dr. Marty Finsterscheib has released, who is taking a lead role now with testing, has released an initial set of recommendations around frequency of testing. And bottom line, what you can see here is it recommends fairly frequent testing of people who are out, especially in higher risk professions, such as the skilled nursing facilities or within the shelters, and making sure that all of this testing is available on a regular and frequent basis for all of these key groups. So one of the things that we as a city have done is identified a site for the Verily testing, which is now both at the fairgrounds and at the Pal Stadium on the east side. Here's the initial data from that testing site. And it shows that we are beginning to test approximately hitting above, slightly below the 200 tests a day mark. So the total data that I've just got updated as of yesterday is we've completed actually 1,480 tests total. And we are set at about 250 people to be seen or tested each day. It's going up. The site's current capacity is at about 300 daily. Verily has let us know if we hit that capacity, they can probably double that to about 600 a day. So our goal is to try to drive traffic and to support the county in driving traffic to increase the utilization of this important site. So in addition, the county is the lead on sites. The county is also undertaking work on ease of use, and the county is also the lead on outreach. We have offered support in site identification, especially to make sure that they're getting into all of the areas of our community that have need. And in the case of the Verily site, we've taken over traffic management, though that was technically a county obligation under the contract. In terms of ease of use, the county has not asked for our support. We believe we could assist in making the user experience better and perhaps improving the registration process, but they have not requested that. And then on outreach, we are doing some additional community engagement, but again, are asking to collaborate more tightly in the development and rollout of an overall engagement strategy that works for all of our community. So let's take a look at the next one, tracing. Tracing is, our contact tracing is really identifying everybody who's come into contact with somebody who has tested positive for COVID-19. Ideally, those people would then self-isolate, quarantine themselves, technically speaking, and monitor for symptoms. And if they test positive, that process would continue on down the chain. So you see here, individual A has been going to home, taking the bus to work, and been coming back to home. He's been close to people at work and on the bus. And then after 5 days in this scenario, they test positive. And so what contact tracing does is goes back and gets in touch with everybody at the home, ideally on the business and train, and you can see how difficult this is, those who are close at work, and it contacts them and has them isolate. And then ideally does a second level of contacting everybody who was contacting. And in the most aggressive version, does a third tier and notifying the third tier people who were contacted by the people who were contacted. As you can see from the math of doing this for just one person, in the ideal, this is very, very complicated, very, very labor intensive, and very, very data intensive. So to have a good tracing capability is core to the public health response of containment, and not going back into either a full-on epidemic or having to return into shelter in place. So by the county's own criteria, they want to be able to do this with at least 90% of the cases, ensure that 90% of the people that they reach out to within those cases are able to isolate, and that 90% of the people contacted are identified, and 90% of the identified contacts can safely quarantine. So it's sort of making sure that they're getting a high level of effectiveness on tracing. They'd like to do this for at least 70 cases. I suspect that number would be higher in their ideal, but that's their threshold. Currently, they're able to do it for about 25 cases a day. So about 1/3 of the way to where they need to be in order to feel like they've got this completely to the point where we could come out of shelter in place. So the county has asked for our assistance in this, and they have asked for our assistance in the form of providing personnel who have qualifications, ideally both in data analytics and medical terminology, as well as language competency and cultural competency, with a specific focus on Spanish, Vietnamese, and Chinese. They need, as an initial estimate on their side, a total of 680 case investigators, and have asked each of the cities to provide as many people as possible to help them get to this number of 680. I wanted to lay out for you next 3 options that we are discussing and evaluating on how to respond to this need and to respond to this letter in terms of the county's request for city to loan tracing staff. The first is obviously to send them the city staff they've requested. In that case, the city would identify and reassign staff matching the technical and language qualifications. The county would train the staff in contact tracing and the necessary business processes, and then they would be on a tour of duty as contact tracers for 6 to 12 months. In this scenario, the city would continue to pay the salary and benefits for those employees, and they would be loaned or seconded over to the county for the duration. So evaluating this scenario along 4 criteria, the effectiveness is okay. We estimate there are probably 20 individuals, many of them in the library system and part-timers, who might fit with these requirements. Most of the other folks who fit with the requirements, and there are a number, are either in police and fire and fully deployed, or in other departments working on core essential services and not available for redeployment. The cost would be high because we would have to continue to pay those individuals at full cost, and that cost would not necessarily be reimbursable for us as a city. The opportunity cost, which is what we would have to forego in order to do this, is also meaningful, significant, because it would just require us sending that staff over and not having them available for things like, for example, deployment on food or homeless response, other areas that we have been redeploying staff to. In terms of job creation, which is a category that has been mentioned several times by the mayor and many council members, this would do nothing on the job creation side since all of those people technically are employed. So second option that we've created and want to explore is the idea of creating a volunteer tracing corps. As somebody who was a Peace Corps volunteer, Peace Corps trainer, and has worked with AmeriCorps and City Year over the years, the idea is to sort of take that model and build it out locally, either by working with a nonprofit like City Year or by creating a similar approach. In this, we would recruit focusing on recent grads, unemployed, and retirees. Those folks would undergo an intensive short-term training, both in contact tracing, building them up as a team, cultural sensitivity, and medical language where they needed the specific terminology and the language, hopefully, that they already spoke. Again, Spanish, Vietnamese, and Chinese being the highest priorities. They would then sign on for a 12-month, probably renewable tour of duty, and typically, as is the case, receive a modest stipend, some healthcare guarantees, and modest housing or a housing stipend. From this, we think this could be very effective. There are a lot of people in the recent grad, unemployed, and retiree area that have the qualifications around data, medical language understanding, and the language pieces. The cost would be lower for us, we believe, because this would be a lower salary than typically we're paying to a full-time, fully benefited city employee. The opportunity cost is still there. It takes a lot of work to put together and run a program like that. And the effort doing that means we're not doing other things. And it's kind of a green light, we think, on job creation, because by definition, a lot of the folks we're pulling in would have this opportunity to work and have something to add on to their resume, especially for the recent grads. Third option is more of a matching option where we connect community to tracing jobs. So in this scenario, Work to Future and other organizations would recruit from among the unfortunately large number of unemployed and underemployed people. We would do some initial preparation and screening to get them ready to interview. The county would then interview and hire the most qualified candidates. The county would undertake the training, and in a temporary position probably would keep them assigned to the contact tracing work as long as needed. From the city's perspective, this has a high level of effectiveness because you can recruit exactly the people that you need. The cost is moderate because, again, we're already doing a lot of this work through Work to Future, and the salaries would be lower than the city staff. Opportunity cost is smaller, again, because we are already doing this kind of work with Work to Future. And again, the opportunity for job creation is inherent in this approach. So these three approaches, we think, are ones that we'd like to discuss, both with you all and with the county, in terms of responding to the very felt need to provide a more robust capability in tracing at the county level in fulfillment of the county's responsibility. So tracing at scale, we see the county continuing to lead in recruitment, training, management, and funding. They've requested us as staff, which I've outlined 3 ways that we might respond. In terms of process, they're creating case investigation protocol and supporting business processes. They have not asked for our help in that. They're also doing data collection and tracing technology. We have offered, but they have not asked for our help in that. There's an awful lot of work in both the process and technology area that needs to complement the people work in order to be able to scale. And we'll have, let's see. Last one is supported isolation. And this is the idea that people who have COVID can't be sent back to a crowded home, or in some cases can't take care of themselves, or in some cases don't have a home to go back to. So we've already doing this, and Jackie Morales-Ferrand and her team are working with this with a particular focus on unsheltered individuals in collaboration with Key Lee and the county. But the idea that anyone who needs supported isolation should be able to have it either in a motel, in the trailer facilities we've opened up, or others. In addition to housing, we believe there's a wraparound need for cash assistance, access to phone and internet, potentially childcare, food, medical care, and social and language support. So to give you a sense of where we are, we have about 550 people who've already fit into this category over the course of the epidemic that we've helped place and support in collaboration with the county. And in addition to, of course, the sheltering work that we've done to meet the unsheltered needs. So with this, the county is very much in the lead again. We've been partnering on housing. In terms of food, at the request of the county, we have been taking the lead. You'll hear more about that in an item later. And then in others, it's a partnership between us with the county, obviously as a social service provider, and the medical and health provider in the lead on both of those. But we have been supporting with rental assistance in many cases. So our proposal as we're going forward and beginning our conversations with the county is that we work as one team. And we believe the way to do that is through the emergency management approach of what's called a multi-agency coordination group, where the principals come together at a leadership level, debate and decide, and set the direction for the team. And we believe that testing, tracing, and supported isolation are not 3 things that happen independently or things that we are just simply silent partners on, but things that we need to help set the course, especially since we have over half the population of the county here in San Jose and a disproportionate share of the impact of this disease. So that is our starting point for our discussions with the county in this extremely critical area of testing, tracing, and supported isolation. So with that, our 2 key questions that we go forward with in this conversation with the county are: how do we create a one-team approach? And what is the best way for the city to support the county, especially as it scales tracing? So with that, I'm going to turn it over to Lee, who is going to take us through the presentation on the COVID-19 financial recovery. Lee, all you.
Thanks, Kip. Can you go to the next slide, please? Just want to remind everyone that our financial recovery is threefold. First, that we'll continue to do recovery right by focusing on our most vulnerable and at-risk populations throughout the COVID-19 response. We'll continue to maximize our reimbursement approach by matching all of our federal and state funds to our response through clear documentation processes so that we don't lose out on any potential reimbursements along the way. And both of those will help ensure that we minimize our any potential impacts to our city's general fund. Next slide. And I'm going to hand it off to Luz to walk through the initial use strategy and update on our budgetary work before I hand it back over to myself and Jim Shannon to talk about the Coronavirus Relief Fund and aligning it with our budget process.
All right, good afternoon, council members, mayor. Last week, you saw this slide for the first time, and we presented an initial use strategy that contemplated needs for COVID-19 related response and recovery activities through the end of the 2020 calendar year. Since then, we have refined some of our estimates and fully expect to continue to refine these numbers as we get a better picture of what is needed as the city moves from response to recovery. So one, we have increased estimates for personal protective equipment, that's PP&E, as the county shelter-in-place restrictions ease and the city begins to return to some sort of normal under social distancing protocols. Two, we have increased estimates for consulting and support as we will need expert advice to guide the city through the response to and recovery from COVID-19. And three, we have decreased our estimates for food distribution. What we're looking at here is how the need for food distribution will decrease as individuals return to work, move into longer-term feeding programs such as WIC, CalFresh, or SNAP, as it's sometimes known, the unhoused, and senior nutrition programs. The food distribution numbers are some that especially will continue to be examined closely and further refined. And yes, I know I've used the word refined 3 times, but we are really refining these numbers. Next slide, please. I do need to remind everybody that all these estimates are evolving as how we need to respond to the crisis as the crisis moves from the intensity of the first few weeks to now a sort of more baseline process, I guess I would say. And as the city gets additional clarification around FEMA reimbursement, other CARES 3.0 initiatives, and future stimulus and or relief programs from the federal and state governments. This is also a slide that you saw last time, and the city is continuing to build its citywide strategic funding plan. Staff is convening a citywide grants planning group, which is made up of department representatives who are all pursuing funding through the various avenues that have opened up to address the challenges of the COVID-19 event. Monies are coming at us from all over the place, not just through the federal government, but state funding as well. We have seen the $178 million in coronavirus relief funds that was deposited directly into city coffers late last month. Lee provided a high-level overview of that particular funding source at last week's 3.1, and in a few moments, Lee will be delving deeper into the CRF monies, including the timeline to spend, the key challenges, and what limited guidance has already been provided for this particular color of money. The city has also received supplemental funding through several of the usual programs that the city manages, such as $8.2 million from the HUD Office of Community and Development Formula Programs, including the familiar Community Development Block Grants, that's CDBG, Emergency Solutions Grants, that's ESG, and Housing Opportunities for People with AIDS, that's HOPWA. These federal funds, matched with close to $27.8 million in state funding, will enable the city to enhance its wide spectrum of homeless initiatives that it currently is running. This council has already accepted these funds through budgetary actions over the past few weeks. Last, San Jose Airport has received a commitment of $65.6 million in economic relief, that's reimbursable money, funding that's coming through to the airport through the FAA CARES Airport Program. We continue to get guidance and information on available funding, frankly, almost on a daily basis. With that, I'll turn it over to Lee, who will provide a primer on the Coronavirus Relief Fund.
Thanks, Luz. During last week's City Manager's Weekly Report out on this item, we reported out on the structure and the intent of the CARES Act, or more specifically, the Coronavirus Relief Fund. The council had several questions regarding this fund to help close budgetary shortfalls through our budget study sessions last week as well. So We are going to update the council on where we're at with this analysis, and then I'll hand it over to Jim to show how we're going to bring this into the city's budget process, as Dave had mentioned. It's important to note that the Department of Treasury, as we indicated last week, dispersed these funds to us. They issued guidance for state, territorial, local, and tribal governments on April 22nd, well after we received our additional funding. In addition, the Department of Treasury also issued on May 4th answers to frequently asked questions that state and local governments and tribal governments have been able to submit over the first few weeks. While it's important to know that as we've stated before, the Coronavirus Relief Fund is prohibited from for any government backfilling revenue losses, it does allow a government to support its own costs associated with responding to the public health emergency, or in essence, absorbing some of the payroll that has been associated with the disaster. Our challenge over the last few days is narrowing to an overall spending plan, which is just what Lou's mentioned, but also how we continue to support our response as we build out this budget. I do, as we move forward, additional clarity is going to be important from the Department of Treasury so that we can make the right decisions and really ensure that we are in a position when we recommend things to you to not impact our general fund in a negative manner. However, I do want the council and our workforce to know that we are aggressively working with our partners in other cities and our federal lobbyists to ensure that we have this clarification as we move forward. Next slide, please. Just as a primer, before I hand it over to Jim, the CARES Act, which is what the Coronavirus Relief Fund is in, it provides that payments from the CRF may only be used to cover costs that are necessary expenditures due to the public health emergency with respect to COVID-19. Were not accounted for in the budget most recently approved as of March 27th. For a state or local government, and were incurred during the period of March 1 and ending through this year. So we would actually need to spend CARES Act dollars before the end of this calendar year. Specifically with the payroll expense or guidance that I mentioned, it states that payroll expenses for public safety, public health, healthcare, human services, or similar employees whose services are substantially dedicated to mitigating or responding to the COVID-19 public health emergency is deemed an eligible expenditure. Like us, many other government entities had asked questions about this payroll provision, seeking the additional clarification. And the May 4th FAQs, most of those questions were really dominated by this language. So just so I can read to the council with a specific question, how does a government determine whether a payroll expense for a given employee is satisfied by the substantially dedicated condition? In their response, the Department of Treasury responded that the fund is designed to provide ready funding to address unforeseen financial needs and risks created by COVID-19 public health emergency. For this reason, and as a matter of administrative convenience, in light of the emergency nature of this program, a state, territory, local, or tribal government may presume that payroll costs for public health and public safety employees are payments for services substantially dedicated to mitigating or responding to the COVID public health emergency, unless the chief executive or for the relevant government determines that a specific set of circumstances indicates otherwise. While it is our intention to exercise this payroll function within the Coronavirus Relief Fund, how we do this is still yet to be determined. The administration, as well as the council, did receive a letter from the Police Officers Association highlighting new language that I just highlighted to you. And we will be meeting with our federal lobbyists and other cities, as we have been over the weekend, to get additional clarity. In addition, the administration will be meeting with the Police Officers Association this week and take their analysis and what we're learning from other cities into our own analysis as we recommend how we bring this money or these funds into the budget process. In addition to this option outlined in that letter, the administration has also been tracking all COVID-related time for all employees throughout the city since March 1st. Working with our emergency management consultants on preparing this documentation process for not only FEMA reimbursement, but also the other funding pots, like the Coronavirus Relief Fund, the administration is now refining numbers on what the city's weekly payroll is related to the COVID crisis. This option would also allow the city to charge the Coronavirus Relief Fund for past and future payroll expenses through the end of the year as it relates to COVID-19. So the administration will continue to analyze this fund and build in that analysis into the MBA that Dave mentioned. And to outline that process and how we will bring it into the budget process, I'll hand it over to Jim Shannon.
Great, thank you, Lee. Good afternoon, Mayor, members of the City Council. Jim Shannon, the city's budget director. So last week we reviewed the proposed operating budget and had some study sessions looking at the budget, and we knew at that time that the budget did not include specific costs or funding sources related to the city's response to the pandemic, but knew that we would be coming back as part of as the budget process continued all the way through to budget adoption in the middle of June. So we did, though, last week on May 12th, we did establish the Coronavirus Relief Fund. And so, as we've talked about, that fund is one of our most flexible uses to make sure that we can do the recovery right. Aside from the general fund, the Coronavirus Relief Fund probably has the least amount of restrictions and sort of broad categories of use. And so we want to make sure that we're maximizing the use of that fund to do our response right. And so we want to be really careful about how we program funds there. For the moment, though, we have allocated, Council has appropriated $45 million of the initial $178 million. And that was primarily to fund sort of to see the initial response for things like food distribution, PPE, and some sheltering costs. So that amount will grow. It's as the slide that Lou's produced or talked about a few moments ago. There's a lot of other costs that we're still working through that this fund will help pay for, as well as other sources like FEMA. But so just this is where we are right at this moment of what's currently budgeted in 1920 as we newly established that fund. As we go forward, though, we will be looking to recommend that Coronavirus Relief Fund is used as much as we possibly can to offset those costs of the city that were currently budgeted but had to be redirected toward that response effort. Next slide, please. So our next steps then, now that we have the fund established, is actually folding it into the budget process. So we're going to make sure that we continue to refine our cost estimates to make sure that we're aligning our response with those costs that are most appropriate. So that spider web of arrows that Luz was pointing at earlier, so that's part of our process. But we are putting out a budget, and so we need to make a call. And so part of making a call is our intent is that on May 27th, we would issue an MBA that would do a few things. So one of them would be to estimate the response activities funded by the CRF through December 2020. It will not be the final estimate, likely, because I think conditions will change. But for budgetary purposes, we need to make a call as to what we think our total response effort will be from March 1st to December 20th, or to December 30th for this calendar year. We would be incorporating that, the CRF into the budget document. We would be recognizing any general fund savings due to reimbursement by the CRF for existing resources that have been redeployed to response efforts. And then also in that MBA, we would identify any of those general fund savings to be set aside as a reserve for future use, or potentially to restore some of the one-time funding that is currently considered for elimination or reduction in the existing proposed budget. I think if we had, in an ideal world, these two things don't move separately. They would be as part of one package. But we know that every day, matters in this pandemic. Every day brings us new information as the status of the pandemic, new information as to the status and the need of our response, as well as to the city's budgetary outlook. So every day, we're getting new information about what our budgetary position is going to be. And so all that matters. So as we had the budget that was released last week, looked at what we had to do to have a balanced budget and to get at some of those ongoing reductions that are going to be necessary as we move through these next few fiscal years. We can now pivot to making sure that we're addressing appropriately as part of the budget the city's response costs and making sure that we are appropriately reimbursed for the costs that are eligible to be reimbursed for. So I'll be around later on for questions, but I think now I'm going to turn it over to Rosalind and Kim to talk about development services.
Great, thank you, Jim. Kip, you can go to the next slide. Thank you. So we're here today to provide some updates on our development services activities during COVID-19. So we have information both on our planning as well as building services. So I'm going to start with our planning activity. And as this slide shows, during the 8-week period from March 16th through May 8th, we've actually had almost 200 new planning applications submitted. Normally, on average, we receive about 30 to 35 new applications per week. So we're about 64-65% of our normal volume. In regards to planning permits that have been approved, and these would have been approved either administratively or at director's hearing, at planning commission, or at city council, we've had over 100 of those planning permits approved. And I did just want to take the time to highlight two very important projects that were recently approved. First is the Meridian Affordable Housing Apartment Project that Planning Commission approved on April 8th and the City Council approved on April 28th. And then next down the pike is the Tamian Station Residential Project, which the Planning Commission has recommended approval at its meeting last week. And this project will be coming to City Council for its consideration on June 9th. So I think it's pretty impressive that even during shelter in place that the city has actually approved 850 residential units. Next slide, Kip. So regarding our building permit activity, I actually want to share 3 different pieces of information. So first, I want to talk about just the volume of our building permits. Then I'll be talking about our strategy to address the building inspection backlog that I shared with the council a few weeks ago. And then lastly, I'll share about our current daily inspection counts since the county order has been revised and our inspectors are now able to inspect all construction projects. So first, regarding our building permit activity, so the top half of this slide will show the activity that is ongoing through our virtual permit center. So our staff in the permit center continue to work remotely. However, we're able to continue to take permit applications. And during this 8-week time, we have taken in 300 new permit applications, and we've actually issued nearly 1,000 building permit applications. So we're really glad that we're able to continue to assist our customers there. The bottom half of this graph shows our building plan reviews that staff has been able to complete also during this 8-week period. And that figure is nearly 1,000. I do want to point out, you can see on the graph that there was a dip between March 30th and April 10th. And this was the period of time when our plan reviewers actually shifted their focus on residential projects because it was at that time of the county order that construction could continue or on affordable housing projects. And we find that the reviews of those construction projects, residential some of them are high rise, actually takes longer for staff to complete their reviews. So that's why you'll see a slight dip there. But as you can see, in the last couple of weeks, we have ramped back up and continuing to process building plan reviews. Next slide. So I shared with the council a few weeks ago about our strategy to attack those building inspection appointments that were canceled early on when shelter in place took effect. So I shared with you that in that backlog, we have about 2,000 inspection appointments that were canceled. And thus far, we have been able to complete inspections for 44% of those canceled appointments. We're going to continue, of course, to focus on the remaining backlog. First, our staff continues to be in close coordination with the Office of Economic Development, their Development Facilitation Officer, and doing direct outreach to customers whose appointments were canceled. So we are following up with them, trying to get a better understanding of their revised construction schedules and when they might be ready for staff to actually come out and conduct those inspections. Also, as part of this strategy, we are actually reserving inspection appointments. So at any point, any one of these customers in the backlog contacts us and say, hey, we are ready for our inspection. We can actually put them into our appointment schedule and get their inspection completed. Next slide. So also wanted to provide an update on inspections for what we consider our high impact projects. So these are projects throughout the city, both residential, commercial, office, and commercial retail. There are actually about 27 of high impact projects on that list. And 21 actually of those projects had experienced canceled inspection appointments early on when shelter in place first took effect. And that represents actually was 500 inspection appointments that were canceled, representing about 5,000 residential units and about 4.5 million square feet of commercial space. So to date, we've actually been able to complete inspections for 336 of those. So we're about a 67% makeup rate in terms of working with these customers. And again, we'll continue to work with OED, stay in close communication with these customers, and really be ready when they're ready to reschedule those inspection appointments. So the next slide, wanted just to provide some information to the council in terms of how we manage our inspection capacity and the time it takes to actually conduct an inspection. So the way we do this is our team actually considers inspection counts per day. So normally we do about 500 inspection counts per day. This was pre-COVID-19. And as you can see from this graph, in the last 2 weeks, since the construction activity can now fully resume on all projects, we have been doing a good job of getting those counts completed. So we're at a rate of about 85 to 90% of our normal inspection count activity. So we're happy to see progress in that area. So the next slide, just wanted to conclude the presentation, again, to share with the council the tactics that we are going to continue to use and explore to really drive development during COVID-19. We understand the importance of assisting our development community and our customers. So I shared a couple of weeks ago that we will pursue extending both building permits and planning permits. So on the building permit side, we have actually already extended all building permits for 6 months. So whatever date that the permit currently expires, customers will just simply add 6 months to that date. The building official also has the authority to grant an additional 360-day extension should that be needed. On the planning permit side, we are preparing to do a zoning ordinance change so that we can change the term of a planning permit from 2 years to 4 years. So we'll extend that. And we are on track to bring the ordinance change to the City Council in August. Regarding construction hours and extending those, staff is continuing to work with the City Attorney's Office to pursue an emergency order to extend construction hours. And right now, we're looking at extending so that construction can take place from 6 a.m. to 8 p.m. And we think this is really important as we know that our construction sites have to adhere to the county safety protocols. So we're continuing to pursue that with the City Attorney's Office. Again, I shared about how we will continue to reserve inspection appointments so that we can get our customers' inspections completed. We will continue to monitor the high impact projects in coordination with the Office of Economic Development. And then lastly, we are going to start virtual community meetings. We have several projects that are now ready for either a EIR scoping meeting or for a community meeting so that their projects can continue to proceed. So we are working hand in hand with the EOC Virtual Community Engagement Branch. We have a couple of pilots that we're working with them. And then in additional, our staff is going to be proactive and work with our customers who need these community meetings to move their projects forward. So with that, I think I'm turning it back over to Kip.
Thank you, Rosalind. And just one small in the weeds detail, just to illustrate some of the complexity of this. Rosalind talked, for example, about the construction hours and the necessity from the public health order. One of the reasons that becomes necessary is the lifts that they use, the elevators that they use on the high-rise projects to get the construction workers up and down, have a social distancing requirement. And so you can only get a few people in those lifts. And so you have long lines, socially distanced, of construction workers who are needing to get into those lifts. And if you maintain the normal hours, they really don't have the full construction day that they used to have. So this is just one example of the increased complexity that both Rosalind's team and then the construction workers are dealing with within this new safe environment that they're deploying. And the reason that we're looking at kind of rewriting some of the rules and guidelines around how we operate. I'll close with just a reminder that this continues to be our roadmap where we do focus on compliance with the public health order as our #1 goal. We do that by providing the continuity of existing city services, everything from garbage to sewage that you don't notice to development services, which you do. Supporting our most at-risk communities and populations with food and necessity distribution, homeless support, and local assistance, which is winning actually shout outs from our peers in terms of the effectiveness of our local assistance website. And of course, all of this that we do is powered by people, and making sure that they're safe and productive and engaged is paramount to making sure we're able to do everything that we need to in this response. So again, on behalf of Lee Wilcox and myself, the two co-directors of the Emergency Operations Center, and the over 630 people actively deployed in emergency response to COVID-19. I turn it back over to Dave Sykes, the city manager, and conclude our report.
Yeah, thank you, Kip. Thank you, team, for the report out. And Mayor and Council, we're available for any questions and comments.